7 strategies, I guess you could say, of how what we can do in order to improve healthcare in this country. I am officially on the Lake Sylvia Loop. Just beautiful, beautiful, beautiful. I just cannot say that enough. You know, over the years of my career, and I've heard again and again and again and again how we need to reform healthcare. And of course, you know, several years ago when President Obama was president and they passed the Affordable Care Act, even then I was saying, you know, we're not reforming healthcare, we're just taking the same old healthcare and finding a different way to pay for it. That's not really healthcare reform. That's just taking the same old type of healthcare that we've been using decade after decade after decade that's not working. It's the same healthcare that's got us to where we are one of the sickest countries in the world. So what I have done is I came up with seven ideas, 7 strategies for improving healthcare, for really reforming healthcare. And that's what we're going to talk about today on this little hike. One of my biggest frustrations as a natural healthcare practitioner is just seeing how many medications are prescribed in this country year after year after year. And over the last 38 years of my practice, it's exploded exponentially. So, you know, one of the things I think we could do that would help the health of everyone in this country, of all of us, is prescribe fewer medications. Over half of the prescribed medications in the world are taken right here in the United States. You know, we got 5% of the population taking more than half of the prescribed medication. So it's a big, huge imbalance there. And I think that's one reason why, you know, we're not as healthy as we could be. I think we're taking too many medications. So that's my first thing. We could help reduce, you know, a lot of the medications prescribed in this country if we just stopped marketing them. You know, when they're marketing these medications directly to patients, directly to customers, if you will, and they're encouraging these people to go into their doctor and ask about this medication, well, you know, that puts a lot of stress, a lot of pressure on the doctors to prescribe those things. And you know, and I just think it's wrong. I just think it's a bad practice. I think it's a really bad practice. And every time there's been any kind of really serious effort made to ban pharmaceutical advertising, you know, you can only imagine the lobbying efforts that are raised and the money that's poured in to defeat such efforts. And so this is something that would really take a grassroots effort. And my first thing is we need to prescribe fewer medications. One of my main gripes about modern medicine is they prescribe too many medications. And the second thing is we need to, you know, ban pharmaceutical advertising. We shouldn't be letting these companies market their meds directly to the public. The third thing that really, you know, that really concerns me, and the third thing I think that we need to do to really improve healthcare is let's do some serious research about vaccines. You know, it's way past time, and I know when you just, you know, the pharmaceutical companies, they want to make you believe that everything's been checked, but you know what? I don't believe it has been. Hey, how are you?
Good, how you doing?
Good. So anyway, I just don't think there's really been any legitimate research. What we really need for these things is long-term research studies. Who does better? People that are getting all these vaccines or people who aren't? So, gonna get past that. My third thing is let's do some serious vaccine research. So now for my fourth strategy for, you know, overhauling and improving healthcare in this country, I think it's way past time that we, the collective we, it is past time that we really get behind healthy eating. You know, and this is an area that's even going to be harder to tackle than the pharmaceutical industry, in my opinion. You know, you start talking about food and the food industry and the food giants and the way they market food and sell food and package food and, you know, what's going, you know, wrong there. You know, it gets to be a real conundrum real fast. You know, another thing that we know from the science, you know, you can look at the effects of sugar. The effects of, you know, a diet high in sugar has certain effects on the human body. And yet, you know, that's not been addressed ever adequately in this country. The lobby, the people that you know, the money behind the sugar industry, you know, they overwhelm any attempts made to corral that in. So, you know, we're not going to really improve the outcomes of health in this country until we take a real, you know, make a real serious effort to get behind clean eating, to promote clean, healthy diets in this country by providing food for the masses that support health. You know, it's sad that in this country that, you know, you have to, you know, you have to be a certain income level in order to afford to eat healthy. So, you know, that needs to change. We need to subsidize, you know, healthy food, healthy eating. And I guess really that my number 4 and number 5 kind of go together because, you know, we need to get behind clean eating, but that also means we need to address the food industry. You know, because again, the food industry, you know, I don't think they really care about our health that much. You know, they're more concerned about, you know, selling food and marketing food, and that's okay. I'm not saying they should be concerned about our health. You know, it's not their job. You know, I totally get it, and I understand our free market and you know, and how our society works, and I applaud that. I think that's great. But there's something wrong whenever our free market allows a corporation to produce a food that is actually detrimental overall to human health, and yet they're just allowed to push it to sell more and more and more. But look at the soft drink industry, and you know, they're marketing themselves. They're trying. They want to increase revenue. They want to increase sales. So their job is to try to sell as much soft drink as they possibly can. And you know, so when we've seen the problems with that, we've seen the issues with that people have, and the health results as a result of that. You know, taking on the food industry and making changes, you know, that's something we could do for our farmers as well. You know, I live in farming country, and it breaks my heart when I see, you know, these thousands of acres and all these brilliant, you know, farmers and all this technology that they use and how they can, you know, produce food. And I think, why aren't we using all of this to produce good, healthy, organic foods? You know, let's be moving away from the pesticides. Let's look towards sustainable methods of farming. And I don't know how that would work, but I just think that's one of the directions that we need to be moving toward. And number 6, we get behind natural alternatives. You know, one of the most frustrating things for me as a chiropractor over the years is, you know, seeing these insurance plans that will, you know, they'll pay for someone to go to the traditional medical route to get, you know, thousands and thousands of dollars of diagnostic testing. They'll pay for, you know, thousands of dollars for prescription drugs. They'll pay tens of thousands of dollars, you know, for surgeries. And yet, you know, sometimes we have to fight them for a $35 office visit. I mean, it's absolutely crazy. So what I've seen again and again and again are these individuals who come to see me, and they all right. Guess we can continue now. Had some hikers come up behind me, so if we want to have real healthcare reform in this country, well then, you know what, we got to pay for something other than medicine and surgeries and you know, what we're currently paying for. Patients will come to me and they want to pursue a natural healthcare path, but the insurance won't pay for anything. So the insurance won't pay for anything that's natural. All it's going to pay for is drugs and surgery. And so the individuals end up going that route, and I see these people, you know, they don't do well. They just don't do well. That brings me to number 7. If we really want to improve healthcare in this country, I think we need to take the profit motive out of healthcare. You know, and I'm sorry, I am someone who has made his living his entire life in the healthcare industry, and I have made my living off providing natural healthcare services to people. So, and I am grateful. I've made a very good living. I am grateful for the income that my practice has provided for me over the decades of service. And you know, and I certainly think that these physicians, these doctors, these nurses especially, you know, deserve to be rewarded handsomely. They deserve to be paid quite well for what they do. You know, I'm not suggesting for one moment that any of the workers in the healthcare industry should take pay cuts or anything like that. What I'm more concerned about is just looking at the corporations and the businesses, the insurance companies, the pharmaceutical companies, you know, the medical supply companies that are just making tons of money off of healthcare. I think there's been a lot of unscrupulous activity over the years from a lot of different players. That's just my opinion. Keep that in mind. But I'm not basing that opinion on nothing. These are issues, these are questions that I have given a lot of thought to. And I tell you, there's too much money, too much profit being made in healthcare. And when there's profit, I think that runs a really, really risky potential of tainting, you know, what we think is really best, what really needs to happen as far as, you know, the individual is concerned. So anyway, you know what? I'm not going to say a lot more about that. But I would like to hear what your ideas are, you know, and this is certainly, when I say we need to take the profit out of the motive out of healthcare, you know, I'm not talking about socialized medicine. I'm just talking about we need to rein it in somehow, and I'm not sure exactly what that would look like. I'd love to know what you think. Leave me a comment below. Let me conclude by saying this, that, you know, I understand that these issues that I'm bringing up are complicated issues. I'm not saying I know the exact right way to proceed forward with any of these. You know, I'm just basing my points on observations that I've made myself, you know, over my years of being in the healthcare field. You know, there are certainly, you know, brighter minds, people with more insight, with more expertise, who could help navigate through these things. But the thing that's going to be most important is that we get a group of us, get individuals who are willing to put aside any kind of personal preferences, who are willing to put aside any kind of selfish preferences. You know, we've got to put aside any kind of personal gain. We've got to truly look at what is best, what is going to be best for humanity in general. You know, for what is going to be best. And you know, that's why I don't think it's best. I don't think more medications are best. You know, I don't think trying to market medications and to increase, you know, market for medications, I don't think that's for the best. You know, a lot of the foods that we're serving our people, when you go to the grocery store, so much of the food is truly unfit for long-term human consumption if you want to maintain an optimal level of health. So, you know, and the finances, the money of how we're paying for all this is all screwed up. There's too many middlemen. You know, we've got to do some serious research about medications in general, but certainly about the vaccines. We've got to really look at the inexorbitant amount of money that's being made in the healthcare industry. You know, and I think that's something that's going to have to be looked at from a larger societal level. You know, the fact is, when you're in the stock market, you probably have a portfolio that has, you know, pharmaceutical stocks. And so everybody has to step back and we have to take an honest assessment of ourselves. You know, are we being okay with this over-medication of America just simply because it's helping our stock portfolio look good? I just know that if we're going to see serious healthcare reform, I think these are the issues that we really need to address. I have made it back to the campground parking area. Everybody have a great weekend.